The World Health Organization has confirmed several attacks on healthcare centers in Ukraine and is investigating others. The attacks caused multiple deaths and injuries, the agency's chief added in a Twitter message. To give us an update from the World Health Organization is spokesperson Tarek, who joins us now. Thank you so much for your time. We do appreciate it. I think we have gone beyond crisis at this point. Speak to us about how many healthcare facilities have been attacked and are unable to operate due to the state that they are in.
Well, indeed, this is a very difficult moment for Ukraine, and the health system is under immense pressure. Not only we were talking about possible shortages of medicines, of arrival of wounded people that health workers have to treat, but there is also issue of attack on health, whether it's health facilities, whether it's health workers. So WHO has a mandate to monitor and report globally attack on health, and we have started to do that in Ukraine immediately after the beginning of the military offensive. So far, we were able to confirm six attacks, and two others we think are probable, with 6 people who were dead and 12 injured, some of them being health workers. Obviously, there are other reports of attack on health that we are trying to verify. But this just adds to all the difficulties that health workers are facing. So not only they are treating people and trying to save lives, but they risk their own to do that. As WHO, we repeat that health has to be protected, that attacks on healthcare facilities and healthcare workers are not only a violation of international humanitarian law, but it deprives the community of access to healthcare. So it has to stop, and Director General has called today on a Russian Federation to commit to a ceasefire that would provide unhindered access to health facilities, where we as a WHO are trying to bring desperately needed medical supplies.
Certainly, I think the picture is extremely worrying, and if you say you know of 6 attacks and 2 others that could potentially be health facilities potentially be attacked, I'm wondering what the way forward is, Tarek, because it just does not seem as though there is going to be any resolution anytime soon, and people are going to still be in desperate need of health care and to be able to find healthcare facilities and to feel safe at these healthcare facilities. As the World Health Organization, do you know of any plan moving forward to assist these 6 healthcare facilities that have been attacked, but also to make sure that others are not attacked?
Well, there is no really health without a peace. So we were always saying that in times of conflict, health has to be provided, and the only solution is peace. That's why we join Secretary General of United Nations and all the other UN agencies in calling to a solution that would allow humanitarian assistance to get to those in need, and that would eventually help a health system to continue working. So, as I said, it's a really difficult situation now. We are trying to bring in medical supplies. Just a few days ago, we managed to bring 36 metric tons of medicines to assist doctors in Ukraine to perform surgeries, to treat those who are wounded. We are trying to get more, and we will try to find a way to dispatch these supplies to all those who need it. But it's difficult. For that, we need access. Access is the key. And we really have to, as a humanitarian community, we need to raise our voice and ask for those who have the possibility to come to agreement that would alleviate the suffering of Ukrainian people. I just crossed the border a few hours ago from Poland, and it was heartbreaking to see hundreds of people waiting to flee their country for safety. So I think we all have to do everything we can to help Ukrainians right now.
Certainly, and Tarek, I know that you are in Ukraine at the moment. Perhaps just paint us a picture of how dire the situation is. I know we are speaking about healthcare facilities that are experiencing attacks and unable to provide healthcare and assistance to people there. But how devastating is the picture at the moment? And I want to link it to this question that already healthcare facilities across the country, across the globe, are already stretched because of COVID-19. So you can only imagine how devastating this is in Ukraine.
Well, exactly. For example, many people in Ukraine, just like in many other countries, have been postponing their health interventions or were not able to access health services because of the pandemic for 2 years. And now already vulnerable people in Ukraine because of the pandemic are facing even worse situation where their cities are being shelled and where it is difficult to get any sort of service and going in some areas, just going to hospital, try to look for health service is dangerous. And again, this also applies to health workers. They risk their lives every day by going to their job. And on top of that, we see these attacks on healthcare. So the situation is very difficult. We, again, from WHO are trying really our best. We are on the ground. We are in contact with health authorities, trying to see where the situation is the worst and where we can help. Again, there are areas in Ukraine where there is active fighting, where the needs are much bigger than in maybe some other places. But it's important that we have access to those areas and that we preserve health system and that we help health workers here who are saving lives.
Tarek, just a last question to you. Are you expecting the situation to worsen, and are you expecting people to struggle even more to get to healthcare facilities and to get the necessary healthcare that they need?
Well, it's difficult to predict the future, and we all hope that this conflict, like any conflict, should end tomorrow. Now, obviously, what we have seen in other conflicts is as conflict continues, the health system obviously is struggling every day more to continue delivering health services. So really, as I have said, that the only solution here is peace, is return to the situation where we can help people by treating them, by providing pregnant women with the services they need, by treating chronic diseases. And right now, it's a huge challenge here in Ukraine.
Certainly a very huge challenge, and hopefully there is some peace and those who need healthcare can have access to that. We thank you so much, and do keep safe where you are out there in Ukraine. That's spokesperson for the World Health Organization, Tarek Yashevich, coming to us live from Ukraine.